Hi, this is Lisa, registered midwife and certified breastfeeding specialist. I want to talk to you today about laid back breastfeeding. I absolutely love this position. I think it can really empower parents, particularly first time parents. Quite often people are quite scared about their baby and handling their baby and worried they're quite fragile. And actually in this position, it can be a really good way of seeing how strong your baby actually is. So what you're going to do is you're going to be in a semi-reclined position, so whether or not that's in a hospital bed or at home, and so you're going to get yourself comfortable, and so always feeding positions need to be sustainable, and so we're going to bring baby to our breast, so skin to skin position. You can find both my breasts, here they are. So we're going to put baby onto our chest, we're going to expose both our breasts, and we're going to allow baby to use their normal reflexes to move towards the breast, okay? So when a baby is born, we know that in an unmedicated environment, if they're placed on the abdomen, it can use all of their reflexes to use its arms, to use its feet, to scoot itself forward, to move towards the breast. It will lift itself up, that's almost like a mini press up, lift itself up. It will throw its head across and it will bob over towards the breast. And given the opportunity, it will self-attach to the breast. So often this is something that we encourage to be done in the golden hour, with baby being in an unhurried environment and moving towards the breast and allowing to be allowed to sort of lick and nuzzle at the breast. But this laid back breastfeeding position, I think, is just a really, really lovely position for any time. Sorry, I look like I'm a bit uncomfortable, but actually it's a really comfortable position. So yeah, we've got our breast exposed, and we're allowing baby to sort of bob around and move towards the breast. And what we're going to do is we're going to use our arms to sort of create a little bit of a nest for them, so they feel well supported, so they don't feel like they're going to fall. If we had a cesarean section, we have to be a little bit mindful of the feet, because the feet can be down, kicking around down here, and can be a little bit uncomfortable. So we have to be aware of that. So you can maybe use a pillow or a blanket underneath to stop them kicking against a wound. But we allow them to bob and look around and find the breast. Now in this position, they can sometimes get a really good deep latch without you having to do anything. I'm obviously having to hold my baby's head to get them to move around, but your baby will simply push and move themselves and find their way to your breast and self-attach deeply onto your breast. You'll be able to enjoy feeding in a very relaxed environment. So I really would encourage you to do this. This is also my favourite position for tummy time. So the health visitors will start banging on at you about tummy time and the importance of it. And it is a really excellent thing to do. But don't put your baby on the floor and lie down there. Just put them on your chest and enjoy this really good face-to-face contact with them. This is a really nice position for you to share with your baby. They're really, really strong. They're really, really capable. And if they decide that they want to have some milk at that time, then they can make themselves their way across. We give them a little bit of support and they can self-attach and they can have a lovely feed. All right. So that's laid back breastfeeding, sometimes referred to as biological nurturing. Really encourage you to give it a go and enjoy your breastfeeding journey. You take care.